This is One on One.
We're pleased to welcome Dr. Jim McGinty, who is Chief of Surgery and Surgical Services at Englewood Hospital and Medical Center. Good to see you, Doctor.
Thank you for having me.
Let's talk about weight loss surgery and how it's changed, just say in the last 5 to 10 years. That's one of your areas of expertise.
That's correct. So weight loss surgery has changed. Really, the way we think about the disease of obesity has changed over time. Obesity is a chronic condition, and it's a growing problem in our country. What we now understand about it is that once you reach a certain weight over your ideal body weight, 80 to 100 pounds, for example, or more, you're really locked into that weight.
What do you mean locked in? Well,
there's a center in your brain, the hypothalamus, that actually is the set point that controls your weight, sort of like a thermostat would in an apartment. And that weight is set, and for whatever reason, we don't understand the mechanism, but for whatever reason, in patients who reach about 80 pounds over their ideal body weight, that becomes their set point. And really, everything they do to try to lose weight is undermined by that part of the brain. So for instance, many times patients will come to us and say, I've tried everything. I've dieted, I've lost about 30 pounds or so, and after about 6 months, I'm still eating the same thing. They come back 6 months later and they're starting to gain weight again. So research has now shown that it's this set point that is driving that mechanism. And really what happens is that as you start to lose weight and come down off of that set point, your body thinks you're starving. And so it slows your metabolism down, it increases your hunger and your appetite, and by the end of 6 to 12 months, you're back to where you started.
Different types of options, describe them for weight loss.
So really the most popular one now is called the vertical sleeve gastrectomy. All of these surgeries now are done standardly through small incisions, what's termed as laparoscopic surgery. So the sleeve gastrectomy is an operation where we remove the baggy part of the stomach. If you think of your stomach as a bag, we're really just removing the part of the stomach that holds extra food, and we create a tube out of the stomach. And the way that works actually is to remove a part of the stomach that makes a hormone that is an appetite stimulant. It's called ghrelin. And ghrelin is a very powerful appetite stimulant. And when we remove that part of the stomach, what we see in the blood is that the hormone level decreases almost to zero. And what patients tell us is that they just don't feel hungry as much as they did before.
You don't eat as much.
You don't eat as much.
You don't want to eat as much.
That's right. And it's not that patients are coming in and saying to us, you know, I'm so hungry and I just want to eat, and it's getting stuck as I'm trying to eat because it's too tight. It's more that they just don't feel like eating as much or feeling as hungry or cravings for foods that they
Is there another procedure that we should mention?
So the one procedure that we've done in the past, and we've been doing for decades, and it's a very effective operation, is something called the Roux-en-Y gastric bypass.
The bypass.
The bypass is where we make a small pouch out of the stomach, but then go downstream on the intestines and divide those and bring it up to that pouch. So essentially, you're diverting the food stream around the main part of the stomach and around the first few feet of the intestines. And so for a while, we were thinking that that also worked because of restricting how much you can eat or how many calories you could absorb. But really what actually happens is that it changes the hormones that communicate to that center in your brain. So, and in the last 5 to 10 years, we've actually discovered dozens of these hormones that are made in the intestines that talk to the brain and the other organs that will reduce your appetite and boost your metabolism.
Doctor, real quick on this, post-surgical care, describe it.
So that's also changed in the last 15 years since I was in training. In the past, we would do most of these operations through a large incision, and so the patients were often in the hospital for days, many complications, hernias, wound infections. Nowadays, because we're doing it laparoscopically and because we've refined our technique and are all accredited by a quality assurance board, our techniques have improved. So now patients are often going home the same one day after surgery, typically back to work within a week or two. One day, yeah.
So recovery is very different.
It is. It is a lot less pain. And the recovery pathways that we've developed have really enabled patients to get started on their diet much faster than they have in the past.
Before I let you out of here, give some advice to patients struggling right now. He or she should do what? Who should they talk to?
Well, unfortunately, obesity is a multifactorial disease, meaning that there are many, many different causes. The environment that we live in, the foods that we're presented with, and so genetics is involved as well. But I think if you're struggling with weight, and a vast majority don't qualify for weight loss surgery, but really need to focus on eating the right foods, and that means no processed foods, really trying to go with what God put on this earth, vegetables and fruits being the main thing, and avoiding the processed carbohydrates and fatty foods.
But if you need help, there's nothing wrong with asking what options are out there at a certain point.
Absolutely. I think this is a difficult disease to go through without help. And so the resources are out there. Your doctor, your primary care doctor, nutritionists, and behavioral psychologists all can be a powerful help to support patients
You
who are
just
trying
helped
to
a
lose
lot of
weight.
people, Doctor. Thank you
I
so
hope
much.
so.
We appreciate
Thank you for
coming
having
in
me today.
as part of our ongoing discussions with clinicians from all walks of life who are making a difference in the lives of other people. Thanks so much.
It's my
Stay
pleasure.
right
Thanks
there.
for having me.
We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Delta Dental of New Jersey, the Healthcare Foundation of New Jersey, Kessler Foundation, the New Jersey Reentry Corporation, New Jersey State Nurses Association, and the Institute for Nursing, New Jersey Sharing Network, and by Community Food Bank of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.